Imagine spending a day exploring the lush forests or working in the fields of Southeast Asia or Northern Australia. You return home feeling fine, but within days, you're hit by a sudden fever and chills. A mysterious black scab appears where a tiny insect bit you, and soon, a rash spreads across your body. What could be behind these alarming symptoms? You may be facing Scrub Typhus, a stealthy but serious disease transmitted by the smallest of creatures, chiggers, the larvae of mites. Today, we're diving deep into the world of Scrub Typhus. We'll uncover its symptoms, how it's diagnosed, what treatments are available, and most importantly, how you can protect yourself and your loved ones. Let's get started. Scrub Typhus, the facts. Scrub Typhus, also known as tsutsugamushi disease, mite-borne typhus, or tropical typhus, is an infectious disease caused by the bacterium Orientia tsutsugamushi. Unlike many bacteria, these organisms can only live inside the cells of other living things. Their primary hosts are mites, particularly their larvae, commonly called chiggers. The disease is most prevalent in regions such as Japan, Korea, China, India, Southeast Asia, and Northern Australia. Humans typically become infected after being bitten by an infected chigger while participating in outdoor activities like farming, camping, or hiking in grassy or wooded areas. Symptoms of Scrub Typhus. The first signs of Scrub Typhus usually appear suddenly, anywhere from 6 to 21 days after the bite from an infected chigger. Here's what to watch for. Fever and chills. The illness often starts abruptly, with a high fever and chills. Headache. A severe headache is a common early symptom, often accompanied by general discomfort or malaise. Swollen lymph nodes. Lymph nodes near the site of the bite or elsewhere in the body may become tender and swollen. Black scab, eschar. One of the distinctive features of Scrub Typhus is the formation of a dark crusted scab, called an eschar, at the site of the chigger bite. This eschar is often painless and may go unnoticed, especially in hidden areas like the groin, armpit, or underclothing. Cough. In the early days of the fever, some people develop a mild cough. Rash. Around 5 to 8 days after the onset of fever, a red spotted rash may develop. This rash usually spreads from the trunk to the limbs, but it can vary in appearance and intensity. Without appropriate treatment, the illness can progress to involve multiple organs, potentially leading to serious complications such as pneumonia, kidney failure, or even inflammation of the brain, encephalitis. Early recognition and prompt treatment are crucial for a good outcome. Diagnosis of Scrub Typhus. Diagnosing Scrub Typhus can be challenging, as its symptoms can mimic those of many other tropical infections. However, certain clues can help healthcare providers reach the correct diagnosis. Clinical evaluation. Doctors will assess symptoms and ask about recent travel or activities in regions where Scrub Typhus is common. Exposure to grassy fields, forests, or rural areas where chiggers are present is a key risk factor. Rash examination and biopsy. The presence of an eschar and rash can strongly suggest Scrub Typhus. Sometimes a biopsy of the rash or eschar is performed for laboratory testing. Blood tests. Blood tests can detect antibodies against Orientia tsutsugamushi. However, antibody levels may not rise until a week or more after the illness begins, so repeat testing may be necessary to confirm diagnosis. Rapid laboratory techniques. Advanced methods like immunofluorescence assays and polymerase chain reaction, PCR, can detect the bacteria more quickly and accurately using samples from blood or the rash. Because the disease can worsen rapidly, doctors often begin treatment based on clinical suspicion, even before laboratory confirmation is complete. Treatment of Scrub Typhus. The good news is that Scrub Typhus responds well to prompt antibiotic treatment. The standard therapy includes doxycycline. This antibiotic, a member of the tetracycline family, is the treatment of choice. It is typically taken by mouth for at least 7 days and continued until the fever has been gone for at least 48 hours. Most people show rapid improvement after starting doxycycline. Use in children. Although tetracyclines can cause tooth discoloration in children when used for prolonged periods, short courses of doxycycline, 5 to 10 days, are considered safe for children of all ages, according to the American Academy of Pediatrics and other medical experts. Alternative antibiotics. In rare cases where doxycycline cannot be used, alternative antibiotics may be considered under medical supervision. With timely treatment, the prognosis for scrub typhus is excellent. However, delays in therapy can lead to severe and sometimes life-threatening complications. Prevention of scrub typhus. Preventing scrub typhus focuses on avoiding contact with infected chiggers and reducing their presence in the environment. Environmental control. Clearing brush, tall grasses, and weeds near habitation and work areas can help reduce the population of chigger-bearing mites. Insecticides. Spraying infested areas with appropriate insecticides can further decrease the risk. Personal protection. If you're engaging in outdoor activities in regions where scrub typhus is common, take these precautions. Wear long-sleeved shirts and long pants, tucking pants into socks to minimize skin exposure. Use insect repellents containing DEET on exposed skin and clothing. Avoid sitting or lying directly on the ground in grassy or bushy areas. Prompt showering. After outdoor exposure, showering and changing clothes can help remove any chiggers before they bite. There is currently no vaccine for scrub typhus, making personal protective measures and environmental management especially important. Scrub typhus is a reminder that even the tiniest creatures can have a big impact on our health. By understanding the symptoms, seeking prompt medical attention if you become ill, and taking steps to prevent chigger bites, you can protect yourself and help spread awareness of this important disease. Did you find this information helpful? If so, don't forget to like this video, share it with friends and family, subscribe to our channel, and turn on the notification bell so you never miss more fascinating and important health updates from MediByte. Stay safe, stay informed, and see you in the next video.